And I did get my family's blessing to say, well, now that you've achieved what we asked you to achieve, we don't really care what you do after that. And so I took the training in the hospital because I thought it would get me off some shifts, right? And I'm like, well, this is great. I'd
Yeah,
rather learn this than this. And then when I was learning it, I realized that there's going to be a time where this stuff has to be more powerful than just simply practicing medicine. And I sort of took a bet on that and sort of eased myself out and into the technology field. And plus, at the time, there was a lot of change in healthcare where practices were being bought up and you ended up working for a big corporation versus working for yourself because it was
sure.
too unaffordable to work for yourself. So that's like how I ended up in on the dark side, and then did some .com stuff before it went .bomb. Ended up going back home to the UK. So I was trained. I came over to Chicago and lived there for about 12 years.
Oh,
But
okay.
I went back home because my dad had a serious heart attack and somebody needed to run the family business. And of course, I knew how to do that. So I went back to run it. And our manufacturing business, we used to manufacture cooking oil.
Hmm.
I sold that to Kraft Food.
Oh,
So after I did that, I was coming back to the States. But my mother said, well, why don't you work for the National Health Service? They could use someone like you. And of course, parents always say good things about their kids. And my view was they
of
probably
course.
couldn't use someone like me. And she said, well, why don't you apply for one job and see if you get it? And if you get it, you're going to stay. That's the bet. So we took a bet. So I applied for a job as a CIO at a women's hospital, tried very hard for them not to hire me, and they hired me anyway. So I lost the
Now,
bet, so I had to
that
stay.
was in Liverpool, right?
Yeah, it's in Liverpool. Yeah. So then I ended up
Okay.
being in the National Health Service for just over 12 years, working in women's and children's care. And it was a great ride. The National Health Service is, people are very proud of what it achieves, which is, free point of care service. And people work very hard. And I learned a lot of things about how to run organizations at minimal levels of investment and how to think outside the box when you don't have any money. And I would never give that up now because I think that's really important to have learned that. But whilst I was working in the National Health Service, I got an opportunity to work for Gartner, and they promised that I would get full exposure to different international scenarios of healthcare.
Hmm.
And, it was going to be free travel. So I was like, well, there's no downside to that. Can learn about different countries and how they work and work with governments and everything else. And so I did that journey for a while. And whilst working there, I sort of developed into their lead for Epic EMR. And
Hmm.
Cambridge came along because they had put in Epic, first one in the UK, and it wasn't fully complete, and they had some outsourcing money challenges, and we were providing them advice. And the chief medical officer there told me in a meeting, he said, well, the advice is really expensive. And I know you've worked in the NHS and I know you grew up in the UK because pretty much everybody knew me. And why don't you just come and work for me and help me solve some of these problems? And he told me the upside being Cambridge University is a very well known, internationally recognized and respected place. And he told me he would make it worth my while. And I thought he was a nice guy. It was a good reporting line. And, usually you work for people, right? Do you think you're going to make a difference? So I took the challenge and then I worked for him for a few years. And I've been at Seattle Children's now for 7 years. And this came along through a similar model. They were looking for a CIO who had more international experience. They'd had a lot of turnover at leadership level. They wanted some stability. They invited me to Seattle in June for an interview. It was my first time to Seattle. I didn't really know that it was rainy. So it was beautiful in June. And then once again, I clicked very well with the CEO who I work for now. And you work for people.